Hi, I'm Jason Garraway, owner of 316 Health Insurance, and I want to share with you today some exciting new news about the Affordable Care Act and the family glitch that's recently been fixed. So when the Affordable Care Act was passed in 2010, it opened up federal money to help people buy health insurance that couldn't afford to buy it on their own. But Uncle Sam said they're not going to give you money to buy health insurance if somebody else is willing to foot the bill. For example, if you qualify for Medicare, Uncle Sam's not going to give you federal money in the Affordable Care Act to buy health insurance. If you qualify for Medicaid, or here in Kansas, we call it CanCare, the CHIP program in your state. If you have access to VA benefits, Uncle Sam says, we're not going to give you money. If you qualify for an employer-sponsored health plan, and that plan is deemed to be affordable for you and your family, then Uncle Sam says, we're not going to give you money. So most folks that leverage the Affordable Care Act were either self-employed or worked for a company that didn't provide health insurance, or maybe they retired. It was for people that bought it on their own. But one of the biggest, most exciting changes we've just seen in the Affordable Care Act is how Uncle Sam now deals with families who have access to employer-sponsored health insurance. The way the rules worked prior to 2023, if I were an employee and I had access to health insurance through my employer, and the premiums for my health care were less than about 9.5% of my household family income, then my entire family was deemed to have affordable health insurance, even though the cost for me to add my wife and kids to our plan cost me perhaps thousands of dollars a month to buy health insurance. This is what became to be known as the family glitch. So if I worked a job that didn't provide me health insurance and I made $60,000 a year and I had a family of 5, Uncle Sam may have $1,500, $1,600, $1,800 a month for me to help buy health insurance for my family. But if I worked that same job at $60,000 a year and I had access to an employer-sponsored health plan that my employer paid all my premiums, even though it cost me $1,000 a month to add my family to the plan, Uncle Sam said there were no subsidies available for me. Well, that whole system has changed. Moving forward now into 2023, Uncle Sam is now going to allow families who have access to employer-sponsored health benefits to leverage federal subsidies to help them buy health insurance through the exchange if the cost to add my wife and family to the plan is now over 9.5% of my household income. This is absolutely huge for those that buy health insurance on their own. The federal government thinks that 5.1 million Americans are going to be able to take advantage of the federal subsidies now available to them to help them pay for health insurance for their family. So do you want to see if your family would qualify for subsidies through the Affordable Care Act, even though you have access to group health insurance? I have a lot of folks that feel like the ACA is a substandard level of benefits that's offered by Uncle Sam for poor people, and that's just simply not the case. The Affordable Care Act just simply changed the laws by which health insurance companies have to operate. No more pre-existing conditions. A standard set of benefits called minimum essential coverage that cover things like mental health benefits, maternity services, and preventative care. These are all parts of the Affordable Care Act. We want to help you solve your health insurance problem. If you'll fill out the form on this page, we can let you know in the next 48 hours directly from our office whether or not your family can take advantage of those subsidies. I'm Jason Garraway, owner and managing advisor at 316 Health Insurance, where we help people solve their health insurance problems. We want to help you see if you can leverage federal subsidies to help your family have better coverage at a less expensive monthly premium.